As a physician, something is most satisfying for me is to treat ill patients. They come crying, honestly. You treat them and they leave you smiling. That is the most satisfying thing for me. And because we work in a clinic setting and hospital setting, so where we design a teamwork, we have technicians, we have nurses, we have other personnel there, and as a doctor, we do separate duties, make a teamwork so we can serve our patients better. So this is the important thing. What is a medical doctor? Why are we here today? A physician is a professional who practices medicine. A person who completes a medical school education, completes standard examination, completes postgraduate training, and has medical license to practice. For more elaboration, I will go to this step ladder. You are at the first stage of high school. After you complete it, then you will go for college for 4 years. I will say every profession is good, but because today is for a physician, so our main focus will be on the physician. In 4 years of college, the prerequisites for a medical school are 1 year of biology, 1 year of chemistry, 1 year of physics, and 4 years of English. You complete that, and then all the medical schools, they have an admission test, MCAT, every one of you knows. But that is a standardization test, and with the combination of your grades, your other volunteer work, and this MCAT, you get admission into medical school, and then you spend 4 years in medical school. Basically, 2 years are for the basic sciences, and 2 years are for clinical clerkship you rotate in hospitals. And after completion of medical school, you have other 3 standardization tests. They are known as USMLE, United States Medical Licensure Examinations, Step 1, Step 2, and Step 3. Step 1 and Step 2, they are for admission into a postgraduate training known as a residency program. And Step 3 is for licensure. After 3 or 4 years of training, if you want to stay as a primary care doctor, who are pediatricians, internists, and family doctor, you can continue working as, or if you want to become a specialist, then you will go into fellowship program, maybe 2, 3 or more years. Then, should I become a doctor? This is a question for you. Association of American Medical Colleges, they have formulated these 6 questions, and if your answer is yes for most of them, you are the right person for this profession. Number 1, do you like challenges? Medicine is everyday challenge. If you are especially working in emergency room or in the ICU or in other settings, you have challenge every day. And this is the medical challenges, but you do have other challenges when you have the sacrifices for your family and for your other relatives. Number 2, are you interested in science and how the body works? Number 3, do you care deeply about other people, their problems and their pain? Number 4, are you a good listener? Because as a physician, you have to listen and listen what the patient says. And that's also a part of treatment. If you are not a good listener, you are deficient. Do you enjoy learning to enhance your knowledge? Are you intrigued by the ways medicine can be useful or used to improve life? These are 6 questionnaires. If your answer is yes for most of them, you are the right person for this profession. So how did I decide to become a doctor? Number 1 was personal goal. I had a goal to become a doctor. For you, as a 12th graders, you are 12th grade, right? Everyone? Okay, mostly. So you should have goals, maybe short term and long term. Your short term goal is 1 to 5 years. What do you want to do? And your goal will be to go to college and complete your chemistry, physics, biology if you want to become a doctor. And long-term goal is how do you see yourself after 10 to 15 years. So you must make a goal. And the second thing is family influence. I was discussing before, every family has influence on who is living inside the family. Suppose I will give you an example. My father was a herbal physician. So he never told me to become a doctor. But that was my family environment. And I will also give the example of Wali. He is sitting here. His father is a doctor, physician. His elder brother is physician. His sister, his elder sister, his brother's wife is physician. His 2 uncles, 1 aunt, 3 cousins, they are all physicians. If I don't tell him anything, I don't need to. He is living in that environment. So probably he will follow that. And then role models, everyone has a person he likes and he wants to be like that and follow that pattern. And if you like physicians, you have a role model for the physician. I'm naming physician here because every profession is good, because we are focusing on physicians. And then the basic values to help others, and everyone should have this attitude to help others. And this is one of the qualities of physician. And how to succeed to be a good doctor. Habit to study and learn. Very, very important. Spend time on your studies. And balance your time for studying, watching television and computer things. Make excellent grades, and the only way is to work more. Give time to your studies. 3. Develop a habit to think and analyze. 4. Learn to be sympathetic. This should be quality of everyone, but it is more in physicians, because this is physician day-to-day. And then you make a commitment. Commitment or dedication, very, very important. If you decide to become a doctor, this is your goal. And then you should be dedicated and committed to this. Then volunteer or work in medical environment. You can work in a clinic, you can work in a nursing home, you can work in a hospital, so that you are familiar what is being done there, and then you can decide whether you like it or not. And then after that, be a good person, important for everyone, especially for doctors. What do I like the most about my career as a physician? Serving those who are helpless, sick and suffering. And then empower people to establish well-being. I was discussing the teamwork. Everyone has his duties, and at the end, the patient is much, much better when we treat it. Everyone works. So this is the way we do, and we should be innovative, creative, and think and analyze the things. We work with the challenges. This medicine, or as a physician, it's an everyday challenge. This is a repetition. You work in ER, you have the challenges. Every patient is a challenge there in ER. And then you have the challenges of your family, your sacrifices. So you should be prepared for that if you want to become a doctor. Deal with criminality and medical problems. This is specifically for me because I work for correctional facility in Dallas. So I treat inmates. So that is why I said deal with criminality. They are inmates, but I like it. I love to treat them, and I am very, very satisfied. And then do something that impact life of people and improve their quality of life, and that is what a physician does. The illnesses, the sickness, then your quality of life is gone when you treat and somebody can walk. Suppose there is a fracture, goes to a doctor, he did treatment, and you can walk. Then your quality of life is improved. That is one of the functions of the doctor. Then the quality of a good career, any career, because we are discussing as a medical doctor, so career, choose a career around a personal passion. If if you decide to become a doctor or anything, or any other career, so you should be committed to that and work and spend time of that, and then you will achieve your goal. And any career which you choose should have potential for growth, not a static one. Then personal satisfaction, when you do something, you should enjoy it and you should be satisfied. Financial stability. This is also a very, very important factor of life. As a physician, you are financially stable. I am seeing here most of you are girls. So for you especially, after graduation, if you work 2 days, you can be better than many, many others. Only 2 days a week. That's enough for you. So you will have enough time for your family, you will have enough time for your kids and everyone. Then stability in life. If you are financially stable, other things are good, you are stable in life. And what are the challenges and rewards for a physician? During the process of your medical education, as a doctor, you need consistency, and that requires sacrifices in life, maybe minor sacrifices. You miss a party or big one. You cannot go anywhere because you are working for your patient. And other commitments, then it should be a good career. Every career is good, but this is your liking and disliking. Any career should be respectful and satisfaction when you treat suffering and patient with pain. And then again the repetition, financial stability, and this career is financially stable. And this was repetition again. When you graduate from medical school, your start is $170,000. Start. And after 1-2 years, you are 200,000 plus. So that is financial stability. And these are a few things here. Do what you love and love what you do. So decide very carefully, and what you decide, then love it and enjoy it. And then always learn, and let your imagination to lead you. You decide good things and then work on that and accomplish. Thank you very much. Anyone who has a question in mind, please. Yes, sir.
What class that you took as an undergraduate do you think helped you the most?
Mine was different because I graduated from Pakistan, and there is a different system there. After high school, 12th grade, we directly go to medical school for 5 years. And anywhere in the world, if you want to become a doctor, education is same. The difference is of this system, and different, maybe some countries are well advanced and some are not. So education is same: physics, chemistry, biology, and nutrition. Yes, ma'am.
Are there internships or like shadowing opportunities available for high school kids, like during the summer?
Absolutely, 100%. And if you want to shadow anywhere, you can go to a clinic, talk to a doctor, I want to shadow. He will let you do. Go to some nursing home, I want to work, because that's also a medical environment. Go to hospital, which is closest to your home. Go there, and they have separate. They give them application, and then if they have vacancy or they have a position, they will let you work there. You can work once a week, once in 2 weeks. It's all up to you. But go there, see how they do and what they do, and can you do it or not? You like it or not like it? Because this is your life. When you have become something, this is for life. It is good for you or not. Okay. Yes, ma'am.
So, this is kind of like, about nurse practitioners. So it's basically, you study the same amount of years as a doctor, right?
No.
No? So it's...
The nurse practitioner, and these are called mid-level providers. Nurse practitioner and physician assistant. For physician assistants, after college graduation, you have a 2 years course. And for nurse practitioner, they have a long path. First they are registered nurse, then they do something MS or something like that. Then they have 1-2 years in ICU, and after that, this is a long prerequisite. And then you go for clinical rotations, and then you are a nurse practitioner.
So it's the amount of years you study is less than a doctor?
Less than a doctor, yeah.
Okay.
Less than a doctor. But if somebody cannot be a doctor, then if he wants medical profession, that is the best thing.
Being a nurse practitioner?
Nurse practitioner or a physician assistant. Because even physician assistant, nurse practitioner, they make good. No, I'm not after money. This is what is suggested. Their average is 100,000. So that's not bad. After this much of years, this is not bad. Because that's also part. This is a hard fact. It is a fact.
And also to go to medical school, like, do you need like Social Security and green card to go to medical school?
Yes.
Okay.
Honestly, I don't have the knowledge. But I don't think so. The difference will be of the fees. International graduate, I don't know whether you can give it or not. Because the other students, I think most of them, they get FAFSA or something, some help. So if you are international student without this, I don't think you will be able to pay. So I don't see, I have not ever heard anyone who has come from other country to study here at medical college. Medical fees are very high.
Pretty
But
sure
here-
you can go to school, it's just finding a job after you graduate.
After you graduate, yeah, then you repay them. So that's the first. But one thing, honestly, everyone, hard work. There is no shortcut for hard work. Give time to your studies if you want to be a doctor or any other profession, honestly. A good profession. Hard work is the key. Spend time, yes ma'am.
How long did it take you to pay off your medical school?
I never had any loan. No, because I didn't have any loan, so. But if you, it may be for you, it is mostly 200 or 250,000. So you can, some pay in 5 years, some pay in 10 years.
But if your income is $170,000-$200,000, paying that loan back is reasonable.
Pay as early as quickly as possible. Yes, ma'am.
I know it might be different, but how old were you when you became a doctor?
I was 23. I graduated in 79.
23?
The reason, because I told you, where in Pakistan and other countries too, India, Pakistan, other countries, after high school, we directly go to medical school for 5 years. Simple, 18 plus 5, 23. Here you spend 8 years. Here you spend 8 years. 4 years for college and 4 years for medical school. That's it.
Go to Pakistan.
Yes, ma'am.
So when you came here, you had to go to medical school again?
No. What the system is, when we graduate from anywhere in the country, anywhere in the world, we have a basic medical degree, MD. The names may be different, like the British, they say MBBS. And some countries, they say MD. That is recognized here, but not to practice. After that, we go through all 3 USMLE standardization tests. You are eligible to go for that. And if you qualify for that, then you apply for your postgraduate training residency. And if you, that's a competition. If you are selected, then 3 or more years of residency, all 3 parts, you get your license. But that's a shortcut for anyone who want to go outside, do medical. After high school, you can go, study for 5 years, come back.
You want to go to Pakistan?
Anyway,
Yeah.
there are many countries.
Yeah.
Yeah, anywhere you go there. There are many families here who send their children outside. After high school, they go there 5 years, they come back. And yes.
Okay. So, no other questions?
No other questions?
No. I already clapped, didn't I? Okay.